And Dr. Nelson.
And it's day 12 of the Active Health Protocol here at the office. It also happens to be my mom's birthday today, so happy birthday, Mom.
Happy birthday, Sydney. All right, so yesterday we touched a little bit on the other wonderful side effects, so to speak, of the Active Health Protocol, and with them being Kathy's joint pain and headaches that she was having. I just wanted to give you a short, non-inclusive list of some of the other good side effects that our many participants have noticed in the past. And as we go through this list, you're gonna notice that some of them don't seem like they would be food related. They might be, you might think that they're an overuse, you know, maybe you have a job that you use your arm too much or something like that, or an old injury. But truly, it's amazing what eating well, how it affects your body. So let's just go down the list here and we'll go from there. So more energy, no headaches, which is one thing that you experienced. No heartburn or acid reflux. That's one of the things that we see in our office with patients coming in just to even see me as a chiropractic patient. Tons of people are suffering from heartburn and acid reflux. Once again, that is not normal. It's your body's way of telling you something's wrong. Less sinus and allergy problems, and we're talking about not necessarily just food allergies or food sensitivities, but we're talking about seasonal allergies. No joint pain, right? We talked about that. Less inflammation, which is what I see carry over in the clinic. No more plantar fasciitis. That's another one. A lot of people have plantar fasciitis and they think, oh, well, it's because of my shoes. Sometimes it is. Sometimes it's the way you walk, and those are the things that I fix on the chiropractic side, but there's some people that it's just an inflammatory response and it's related to their diet. The other thing is feel well rested, so sleeping better, better mood, less depression, less anxiety, resolved constipation and diarrhea. A lot of people don't like to talk about that, but it's very important, and it's something that can definitely affect your life. Always having to know where the bathroom is or just making you feel kind of yucky. Less hungry, right? So the wonderful thing about the Active Health Protocol, we do not tell you how much you can eat. You don't have to count calories. You're not counting macros or any of those things, so you don't feel hungry. Kind of piggybacking on the feeling well rested, some people were able to get off their sleeping medicine because now they can sleep better. Stomach doesn't hurt, belly issues, that's huge. We see a big reduction in that. Your clothes feel better, right? So they fit a little bit better with the lost weight that people have. Another one that I find fascinating, and I myself experienced this, is my skin improves. So maybe less breakouts from acne, dry skin, less psoriasis, those types of things people experience as well. Another biggie is you don't crave sweets, right? So that's a lot of people's biggest downfall is that they love sugar, right? I talked about that right my first day, that I was really wanting that Costco cake, but on the protocol and on the program, it actually helps to reduce those cravings. Also, another thing is that not having stiff joints, hands and puffy hands, that type of thing, that was reduced in some people. And of course, we talked about the weight loss, right? So you can see how we talked about yesterday, it's more of a quality of life issue and not just the weight loss piece of it, but all of these things affect people's quality of life, and that's the most important thing about our program, is that getting rid of some of these things. The other thing I do want to mention is specific conditions that go along with this. We've had multiple people with autoimmune diseases, rheumatoid arthritis, Sjogren's disease, and diabetes, yes. So those people have experienced a lot of decrease in their symptom as well. The diabetics do really well on this because their blood sugars drop. Then they're able, in conjunction with their doctor, they're able to reduce their amount of medication. We did have one participant that was on the borderline of having to have insulin and didn't end up having to have it because they did our program. So there's just a lot of really wonderful things that it can prevent these chronic diseases.
Awesome.
Yeah.
Thank you, Dr. Nelson. So over the weekend, we would like to invite questions so that we can give answers, right? So on this video, if you comment your questions, over the weekend we'll be answering those. I know you guys have a lot of questions rattling around in your brain, so lay it on us.
Yeah, and one of your questions can be why does Kathy use her hands all the time?
And the follow-up question will be, why does Dr. Nelson put her hands in her pockets? So whatever question you have, throw it at us. We'll be answering those this weekend, and we'll see you tomorrow.